Hi there, I am Professor Masondo and I specialize in anatomy. I'm going to take you through what happens when you injure your anterior cruciate ligament in your knee, but first I need to tell you about the structures that are involved in articulating your knee. So you have your thigh bone, which we call the femur, and then you have your shin bone, which we call the tibia. Then you also have your kneecap, which we call the patella, which helps protect your knee. So these bony structures are put together by structures called ligaments, which are fibrous and help these bones to move. So when you see here, we have this lateral and medial ligaments, and they're called collateral ligaments. And then at the back here is our specific focus, the cruciate ligaments. So the cruciate ligaments form a cross and they join your femur and your tibia together. So this is your posterior one, the one that you see first, and then your anterior cruciate ligament lies diagonally inside your knee. So the anterior cruciate ligament helps protect your tibia from sliding forward and also prevents rotational injury. So when you injure this ligament, it's usually when you play in your sports like soccer, netball or basketball, where you're running too quickly and then you stop abruptly, or you going down the slope and you're trying to slow down, or you just change direction too quickly, then you injure these ligaments. So what happens when you injure this ligament, you're going to start feeling, you're going to hear a pop first, and then what's going to happen next is that you're going to have swelling in your knee. And when that happens, it usually resolves after some time, but then you will have difficulty with walking properly, and your range of motion may be reduced, which requires you to have surgery. But now I'm going to hand over to my other colleagues in theatre who are going to explain to you and tell you what exactly is going to happen.
Thank you, Dr. Masondo. My name is Dr. Dihalu and I'm the orthopedic registrar, and here we are in theatre. I'm just going to explain some risks and complications associated with the surgery that we're going to be talking about. Before I start, I just want to mention that these risks and complications are extremely uncommon, but however, they do need to be mentioned and you need to be aware of them. In terms of the actual surgery itself, the incision area is actually very prone to infection. You may also experience blood clots, but this is prevented by certain stockings that we place on you before the surgery starts. There may also be associated anesthetic risks, and this is expected in almost every other surgery. In terms of what happens after the surgery, you may notice that your knee is very swollen. What you can do to aid this is place some ice on the area, and this decreases the swelling. Furthermore, the site that the surgeons cut on is very prone to infection, and it is important that you, as the patient, keeps the area dry and clean. You may notice some of your movements have changed, so you may not be able to stretch or bend your leg as you used to. This is extremely uncommon and can be helped with physical rehabilitation. So what is physical rehabilitation? What physical rehabilitation aims to do is to restore you to your normal functional being, to return some sports skills, as well as to strengthen your muscles and to enable movement. The duration of this depends on the individual. Most individuals do take between 6 months and a year. I will now hand over to my colleague, Dr. Apadu, our consultant, who will explain the actual surgery.
I'm Dr. Apadu. I'm the orthopedic consultant. So we're going to explain to you how this ACL repair actually takes place. So there are a few steps that need to be followed. So first, we're going to take out the anterior cruciate ligament that was torn or damaged. Then we're going to find something to replace this ligament. So now this replacement is by using a graft. This is usually obtained from the tendon of the calf muscle. So in the first video that we're going to show you is going to be where we obtain the graft. So we made an incision in this patient's leg, and then now we're taking out the calf muscle tendon. going to make a small hole in your kneecap and insert a camera in. With this camera, we're going to see what's going on in the knee joint. We are going to drill a hole in the bone above and below the knee. This is where the graft is going to lie in a diagonal fashion. So we're going to stabilize the graft at these two places and then use screws to put it in place. After we're done, we're going to ensure that it's stable and it's firmly secured. And after that, voila, the ACL repair is done. So when all the operation is done, we're going to suture all the small holes that we made in your leg, and then we put dressings on and then allow it to heal.
Now that we've shown you what happens when you injure your anterior cruciate ligaments,
as well as made you aware of the risks and complications of surgery,
and showed you how the actual ACL repair is done in theatre,
we can only hope that this puts you at ease and that you can trust these surgeons here. All the best.